that are the auditory hallucinations. If someone has auditory hallucinations alone, they can meet full criteria of schizophrenia as we know it now, even if they don't have delusions. Do you know what I'm referring to? What kind of hallucination would that be? We know it's auditory. It has to be auditory.
Like command hallucinations?
Command, that's a very important type of hallucination, the commanding hallucinations. It's very important and it's serious, especially of what kind of commands the hallucination is telling the person. If they hear voices telling them kill people, or kill this person, or they hear voices telling them kill yourself, you know, it's very important, and that would require immediate hospitalization. And the patient should be hospitalized until the command hallucinations stop, because you don't want to run the risk of discharging a patient that's still having command hallucinations that are psychotic. Now, they can still have hallucinations because schizophrenia is chronic. You can discharge them as long as the command hallucinations have stopped. Okay, so that would be one criteria. But the hallucinations that I'm talking about here are a specific hallucination that you see very, very commonly in schizophrenic people, and almost only in schizophrenic people or psychotic people, as we'll say. And those are hallucinations that are commenting on the person's actions. You see? So it's not necessarily commanding, it's just that the person is doing things, and these hallucinations, they hear auditory hallucinations commenting, not just one voice, but could be 2 or 3 or 4 separate voices, just talking, making comments about what the person is doing. So this is very classic schizophrenia hallucinations, or very classic psychotic hallucinations. You see? So you have the commenting on the person. So it's not just commanding, but it's also making comments. So if you see that a person comes to you, and this person is having hallucinations, and she tells you, I see a little girl who follows me everywhere, or I see shadow people, but there is no psychosis. There is no delusions. You see, would that be psychosis? No, because even if they tell you, I believe it's real, if they tell you, I believe this little girl is real, well, could that be a delusion too? Maybe, but it's based on a hallucination. So the primary symptom is the hallucination, not the delusion. When you question them, who is that girl? You can say, I think it's real. But it's questionable. I mean, for psychosis, you have to have very clear signs that the touch with reality is broken. There is now the fantasy world is ruling their inner lives, their psychic lives. So there is, so if the delusions are bizarre, that's clear symptoms of schizophrenia. If they have auditory hallucinations that are commenting on the patient's actions or behaviors, that would be hallucination. In that case, they don't need to meet the 2 criteria of delusion and hallucination simultaneously. But for the most part, the patients need to have hallucinations and delusions going on together. And most of the time, they go together. Very rarely you'll see only delusions. In that case, will be a delusional disorder, or only hallucinations. It just comes together. You see? Okay. So let's go with criteria.
The third one is disorganized speech.
Okay. So the second is?
Well, 1 was delusions, 2 was hallucinations. The
Okay.
third is disorganized speech.
Disorganized speech. Okay. What would be a disorganized speech?
Word salad?
Yeah,
Word salad. What would be a word salad?
statement without any real content or meaning. They're just saying a lot of different
Right,
words
right.
together. It doesn't have any.
Exactly. There's no syntaxes. There's no grammar. It's just putting words together. And many times it's not just word salad, but it's also making up new words that don't exist, or rhyming. Like a poet, like a very creative poet. That everything you say, they're gonna come up with another word that's gonna rhyme perfectly. How do they do that? I don't know. Maybe the creativity process in the subconscious gets open, right, and filters all that, and poets can get into it. Or artists can get into it without losing touch with reality, but they can go into that world that most of us, under normal circumstances, can achieve, but they can't. But you'll see amazing things with people with disorganized speech. All the things that they were gonna say, even very creative. The rhyming of it, the rhythm of it, it's like poetry. And sometimes they may come out with things that are very, very funny, even just to say, because of the creativity process that comes involved. But you see that, if you see disorganized speech, that's very typical of schizophrenia or psychotic disorder. You see, but that has to come out with something else. Has to come out with the delusions or the hallucinations. The next one.
Is grossly disorganized or catatonic behavior?
Mm-hmm. So what would that be then? Disorganized
naked.
behaviors. What is it?
Running around naked?
Running around naked.
Poor hygiene.
Poor hygiene. Mm-hmm.
Axi flexibility.
Yes, because it's talking about catatonia, right?
Mhm.
So that's one of the symptoms of catatonia. Any example of disorganized behavior?
Like hoarding useless objects, or one of the things that I read once was that they'll drink water till they're intoxicated. I mean, just bizarre things.
Yes, yes, yes. So you see that is a behavior that is not goal-oriented, you see. So we can say that the psychosis and schizophrenia, you can say that it's a disorder, is a thought disorder, just to put it that way. So it has all the intellectual capacities that are being affected that way. So it's a thought disorder. As opposed to other disorders in mental health, for example, depression and bipolar, that they are a mood disorder. A mood disorder. Now, mood disorders can also bring psychosis. But schizophrenia is more a thought disorder. So it has disorganized thinking that affects the speech, of course, because if your thinking rules speech and you talk as you think. So if you see the speech is disorganized as well, that tells you how's the thought. So these are little windows to the patient's world. So you see how they talk, what's their vocabulary, how they express themselves, what's the syntax, the grammar they use, and then that will, if they're making up new words, if they are making word salad, it makes no sense. Then it gives you a window of how the thinking world is in this patient. Right? And then you have the catatonia. It's a behavior that you can see. It makes absolutely no sense. I mean, why would they stand in a position for 2, 3 hours, 5 hours, 6 hours until you move the person and put in a different position like status? It's a behavior that has no goal on it, no sense whatsoever. You see, so you have these behavioral problems that you can see in these people that are behaviors that are not goal oriented. Anything else?
The last one is negative symptoms.
Negative symptoms, what are those?
Flat affect.
Flat affect. So now you have a component, a mood component on it. It's a flat affect, but it's a flat affect that is not depression. Depressive people can present with flat affect, but they're going to be depressed. They're going to have other mood symptoms on it. This one is more like negative symptoms. So we have negative symptoms, positive symptoms. Is an old classification that tells you positive symptoms are more like florid symptoms that you can see very easily, very obvious. Positive symptoms are delusions, hallucinations, behaviors that bizarre behaviors makes no sense. And that would be like running naked into traffic, for example. But on the other hand, the negative symptoms we have now is a flat affect. Anything else?
Anhedonia.
You have anhedonia. Mm-hmm.
Lack of motivation.
No motivation. Yeah. So what would be the difference between anhedonia and lack of motivation?
Didn't have any pleasure at all in anything, as opposed to just not being motivated
Mm-hmm.
to do something.
Usually it comes hand in hand, but it's two distinct different symptoms. The anhedonia is that lack of pleasure in things. And motivation is, they can find the drive to do things, you see. So they come hand in hand. And they are both symptoms of schizophrenia, psychosis, and also symptoms of depression. So they share, mental illness has shared things in common, so that's why we need to really look at how many criteria of one diagnosis is met to classify this illness. And that would be one. Negative symptoms are necessary to make the diagnosis of schizophrenia, or they are included in the diagnosis of schizophrenia. Any other negative symptoms?
Just lots, I mean, very limited speech and, you know, just they're not able to process things and flat, kind of what we discussed.
Mm-hmm. Yeah. I had a patient, a schizophrenic patient, that basically stopped talking. However, the person could understand what was talking, what was being said around her, but she would stop talking. And that was part of the negative symptoms. It was not that she was defiant, oppositional, you know, and she having a selective mutism where she would not talk to you just because she doesn't want to talk to you. It's because she would not talk because she couldn't talk at that moment. The negative symptoms were affecting her speech. You know, so she had no drive. You know, she had no speech basically. You know, she could understand. There was no stroke, nothing that would impair her speech. But she wouldn't speak. And then you have other negative symptoms. For example, the poor ADLs. You know, activities of daily living are affected. So this person no longer is interested in taking showers, for example, brushing their teeth, getting dressed, eat. And so negative symptoms on itself can be a criteria for inpatient admission. Because what if this person is, you know, negative symptoms are so prominent that this person stops taking care of themselves. So at that moment, needs to go into inpatient and have this person, you know, receive, you know, the treatment, try to pull them out of these negative symptoms or improve them until the moment that they can start, you know, eating, feeding themselves. Sometimes we may be in the need of placing a feeding tube, just to give you an example of that, how bad it can be. So negative symptoms will affect almost all the areas of functioning of this person. You know, they're going to be isolating. They are not interested in having contact with people. And obviously, you'll see like this person is like if they were having like a little autism, you know, in very much in their inner world. So they would be the negative symptoms. Anything else about the diagnostic criteria of schizophrenia?
Then they have some other categories like social occupational dysfunction.
Mm-hmm. So then